Welcome to Neuromyofascial Science Today, the podcast where we explore the latest innovations in health, science, and patient care. I'm your host, Patrick Wagner, and today's episode is titled Seeing the Invisible, Retinal Thinning as a Key to Neurological Diagnosis. We're diving into the groundbreaking world of Optical Coherence Tomography, or OCT. Section 1, Introduction, the Retina as a mirror of neurological health. Over the years, the retina, a thin layer of cells at the back of the eye, has become more than just a mechanism for sight. Many medical professionals regard it as a eerie window to the brain, revealing insights into our broader neurological health. Using simple tools like the ophthalmoscope, doctors have historically been able to detect conditions like high blood pressure, diabetes, and even neurological disorders by examining the retina. But what if we could take this to the next level? Today, we'll explore how OCT, a cutting-edge imaging technology, has transformed from a tool for diagnosing eye diseases like macular degeneration into a revolutionary method for uncovering systemic conditions, including migraines, fibromyalgia, and even multiple sclerosis. Stick with us as we unravel how this technology is shaping the future of patient-centric neurological care. Section 2. What is OCT and why is it revolutionary? So, what exactly is optical coherence tomography, and why is it causing such a buzz in the medical world? OCT is a state-of-the-art imaging technology that provides high-resolution, three-dimensional images of the retina. Often referred to as an optical biopsy, it allows doctors to examine the microscopic layers of the eye with astonishing precision, down to just 10 micrometers. Originally developed to diagnose eye conditions like glaucoma and macular degeneration, OCT has since expanded its reach. Dr. Lamb, can you tell us more about how this works and why it's such a game changer?
Absolutely, Patrick. OCT uses near-infrared light to capture detailed cross-sectional images of the retina without any invasive procedures. This light-based imaging technique works by registering reflections within the retina, and its findings are analyzed using computer algorithms and artificial intelligence. These tools help us extract and assess data with remarkable accuracy, making OCT an invaluable diagnostic tool. What makes OCT revolutionary isn't just its precision, but its versatility. Eye doctors can now use this technology to identify early markers of systemic conditions, not just eye diseases. By examining patterns of thinning of the retinal layer, we can uncover warning signs for conditions like multiple sclerosis, Parkinson's, and even Alzheimer's.
It's incredible how a technology initially designed for eye health is now shaping our understanding of neurology. Stay with us as we dive deeper into how OCT can serve as an early warning system for complex conditions. Section 3. Retinal thinning as a neurological early warning system. Let's take a closer look at one of OCT's most significant breakthroughs, identifying retinal thinning as a precursor to neurological conditions. Dr. Lamb, can you walk us through this connection?
Certainly. The retina, specifically the retinal nerve fiber layer, acts as a kind of canary in the coal mine for the nervous system. By measuring its thickness, we can detect early signs of neurodegeneration. Patterns of thinning in specific retinal regions can be directly linked to conditions like multiple sclerosis or even Alzheimer's disease. Research published in The Lancet Neurology in 2016 reported a significant increase in the rate of disability progression in MS patients with greater thinning of their retinas. Their study results provided good evidence in the usefulness of monitoring the retinal thickness by OCT for prediction of the risk of disability worsening with time in patients with multiple sclerosis.
That's remarkable, Dr. Lamb. It's fascinating how something as small as the retinal nerve fiber layer can provide such critical clues about what's happening in the brain and nervous system. The idea that OCT could serve as an early warning system for conditions like multiple sclerosis and Alzheimer's not only shifts how we approach diagnostics, but also opens doors for earlier interventions. It really underscores the importance of regular eye exams, not just for vision, but for neurological health as well. When we return, we'll explore how these retinal changes are connected to symptoms many people experience every day, like migraines, tinnitus, and vertigo. Stay with us. Section 4. Linking retinal changes to common neurological symptoms. Dr. Lamb, let's discuss some of the everyday symptoms that could be explained through OCT imaging. Symptoms like tinnitus, TMJ, vertigo, and migraines. How are these connected to retinal changes?
Research shows fascinating correlations. A 2021 meta-analysis of 26 studies involving migraine patients published in Neurological Sciences highlighted that individuals with migraines, particularly those with aura, show marked retinal nerve fiber layer, RNFL, thinning in the superior and inferior quadrants. Those migraineurs without aura had far less thinning of their retinas, suggesting the actual aura may represent an acute change in the thickness of the retinal layer, contributing to the visual distortion. The study suggested that retinal thinning aligns well with the visual disturbances often experienced during a migraine aura. Similar studies confirmed retinal thinning seen in those living with tinnitus, vertigo, jaw pain, and even sinusitis, suggesting a common neurological link to these conditions.
So, symptoms that seem unrelated at first, like tinnitus and migraines, might actually share a common thread detectable through OCT. That's groundbreaking. Let's move on to conditions like fibromyalgia, where the connections grow even deeper. Section 5. Fibromyalgia and overlapping neurological mechanisms. Dr. Lamb, fibromyalgia is often described as a mysterious condition with no definitive cause. How does OCT shed light on this disorder?
Fibromyalgia indeed remains a challenging condition for many to diagnose and treat. However, OCT provides a unique window into its underlying mechanism. A 2020 study published in Ophthalmology reported that fibromyalgia patients experience not only RNFL thinning, but also changes in optic nerve blood flow. Moreover, the severity of their fibromyalgia symptoms were tied to the severity of the thinning affecting their retinas. As several groups of symptoms such as migraine, tinnitus, and conditions such as MS and Parkinson's all converge upon retinal thinning as a predictable complication, OCT helps to bridge a common understanding of these conditions. By identifying these specific retinal changes, OCT helps us move closer to understanding the neurological fingerprint of fibromyalgia and other conditions. The possible link between fibro, MS, migraine, tinnitus, and other conditions with OCT testing will be explained later in this OCT series.
That's remarkable, Dr. Lamb. It's fascinating how something as small as the retinal nerve fiber layer can provide such critical clues about what's happening in the brain and nervous system. The idea that OCT could serve as an early warning system for conditions like multiple sclerosis and Alzheimer's not only shifts how we approach diagnostics, but also opens doors for earlier interventions. It really underscores the importance of regular eye exams, not just for vision, but for neurological health as well. When we return, we'll explore how these retinal changes are connected to symptoms many people experience every day, like migraines, tinnitus, and vertigo. Section 6, Post-concussion syndrome and retinal thinning. Post-concussion syndrome, or PCS, is another area where OCT is making waves. Dr. Lamb, how is this technology helping us understand the lingering effects of concussions?
PCS is often misunderstood and misdiagnosed because its symptoms can be delayed or seem unrelated to the original injury. In fact, the severity of PCS is unrelated to the severity of the head injury, but PCS also has abnormal retinal testing on OCT. To keep this discussion grounded in evidence-based research, it's worth noting that similar retinal thinning has been observed in neurological conditions like fibromyalgia and multiple sclerosis. For example, a 2020 study titled Assessment of Retinal Nerve Fiber Thickness and Optic Nerve Head Blood Flow in Fibromyalgia Syndrome demonstrated significant RNFL thinning in fibromyalgia patients. Likewise, a 2022 study on optical coherence tomography assessment in familial and sporadic multiple sclerosis showed strong correlations between RNFL thinning and neurodegeneration in MS patients. This suggests that retinal changes seen in PCS may reflect a similar neurodegenerative process, making OCT a valuable tool for identifying and monitoring PCS-related brain injury.
It's remarkable how OCT is uncovering the hidden connections between retinal changes and brain injury, helping us see what traditional tools might miss. When we return, we'll dive into its applications in major neurological conditions like MS and ALS. Stay with us. Section 7. Retinal imaging in neurological conditions. Let's broaden the lens to explore how OCT is being used in conditions like multiple sclerosis, ALS, and Alzheimer's. Dr. Lamb, what patterns are emerging?
OCT findings in these conditions are truly groundbreaking. In multiple sclerosis, for instance, thinning of the retina's nerve fiber layer is strongly linked to disease severity and progression. A 2016 study published in The Lancet Neurology confirmed that retinal thickness could predict disability outcomes in MS patients, providing a non-invasive way to monitor their condition. It should be noted that I already revealed that fibromyalgia severity was linked to the degree of retinal thinning, suggesting a possible link between FMS and MS. Similar studies confirm retinal thinning in patients living with ALS and Alzheimer's. It is suggested that OCT and retinal thinning reflect a broader process causing neurodegeneration in the brain and spinal cord. What's exciting is that OCT may serve as an early diagnostic tool for these conditions, allowing us to intervene sooner and potentially slow disease progression.
Section 8. The Chiari Syndrome Hypothesis. Dr. Lamb. Chiari syndrome is a condition that many listeners might not be familiar with. Can you explain its connection to OCT and retinal thinning?
Certainly, Patrick. Chiari syndrome occurs when the brainstem and spinal cord become compressed at the junction where the skull meets the upper neck. This compression can cause severe neurological symptoms, including chronic migraines, vertigo, tinnitus, and even partial paralysis. I often describe Chiari as a more severe form of post-concussion syndrome because the symptoms overlap significantly. Now, here's where OCT comes into play. Studies have shown that individuals with Chiari syndrome often exhibit significant retinal thinning, which appears to be linked to spinal cord tethering. This tethering creates a traction injury, essentially pulling on the spinal cord and brainstem, and this traction effect can be reflected in the retina, a phenomenon we call retinal traction. What's groundbreaking here is that retinal imaging through OCT allows us to see and measure these changes, giving us new ways to diagnose and monitor Chiari syndrome and related conditions. This is also where my theory of spinal myelopathic syndrome, or SMS, comes into focus. I believe SMS may be the underlying mechanism, explaining not just Chiari, but a range of conditions we've discussed so far. I'll share more about SMS and its broader implications as we progress further in this series.
Section 9, Spinal Myelopathic Syndrome, SMS, the hidden force behind neurological dysfunction. Dr. Lamb, you've introduced the concept of spinal myelopathic syndrome, SMS, as a key factor in many complex conditions. Can you explain what SMS is and why it's so significant?
Absolutely, Patrick. I first described spinal myelopathic syndrome about 15 years ago based on observations of patients with whiplash-like injuries. Essentially, SMS occurs when trauma, whether from an accident, repetitive strain, or other spinal injuries, leads to soft tissue fibrosis or scar tissue forming around the spinal cord. This scar tissue acts much like a tight fist, applying external pressure to the spinal cord and altering its anatomy. The consequences can be profound. For example, this spinal tethering can create a downward traction effect on the retina, mimicking conditions like Chiari syndrome. It's as though the spinal cord is pulling the brainstem and surrounding structures downward, leading to symptoms like headaches, tinnitus, vertigo, and even potential brain lesions. Furthermore, this tethering can trigger a cascade of neurological effects, paralysis in the limbs, dysfunction in the autonomic nervous system, such as dysautonomia in bladder or bowel issues. One of the most remarkable aspects of SMS is its ability to create a complex pain syndrome. This often presents as chronic headaches, neck pain, visual disturbances like retinal traction, and systemic symptoms like fatigue. In essence, SMS bridges the gap between spine injuries and conditions traditionally thought of as neurological or musculoskeletal, helping us understand symptoms that were previously disconnected.
So what you're saying is SMS could be the missing link in conditions where traditional imaging and diagnostic tools have failed to connect the dots?
Precisely. The invisible nature of soft tissue fibrosis makes it incredibly difficult to detect using conventional imaging, like MRI. This has led to misdiagnoses and fragmented treatments for years. However, using neuromyofascial science, we can identify and address this spinal tethering, providing a deeper understanding of conditions that baffle traditional approaches.
Section 10, Connecting the Dots. A unified theory for chronic neurological and musculoskeletal conditions. After exploring so many conditions, from migraines and fibromyalgia to multiple sclerosis and post-concussion syndrome, it seems there are common threads tying them together. Can you explain your unified theory of neuromuscular conditions?
Certainly, Patrick. At the core of this unified theory is the idea that spinal cord tethering, as seen in SMS, creates a traction injury effect that radiates outward, impacting the brain, spinal cord, and peripheral nervous system. This tethering, caused by fibrosis or neuromyofascial scarring, doesn't just remain localized to the spine. It sends ripples of dysfunction throughout the body. Here's how it works. When the spinal cord is tethered, it pulls on the delicate neurological structures of the brain, creating symptoms like headaches, vertigo, tinnitus, and vision problems. This same traction effect can also manifest as retinal thinning, which we now measure using OCT. In fact, OCT has shown us that these patterns of retinal changes are linked to conditions like multiple sclerosis, fibromyalgia, and Parkinson's disease. Additionally, spinal tethering affects the autonomic nervous system, which regulates essential functions like heart rate, digestion, and blood pressure. This could explain the dysautonomia often seen in chronic conditions. Similarly, the spinal cord traction can disrupt nerve pathways to the limbs, causing pain, weakness, and impaired mobility. What's groundbreaking about this theory is that it doesn't look at these conditions as isolated diseases. Instead, it suggests they are varying expressions of the same underlying process, spinal myelopathic pathology. The symptoms depend on where and how the spinal tethering occurs, combined with a person's unique anatomy and injury history.
That's a revolutionary perspective, Dr. Lamb. How does this understanding translate to treatments?
This theory allows us to move beyond symptom management and target the root cause of these conditions, the spinal cord tethering, through advanced neuromyofascial treatments, including techniques to release fibrosis and decompress the spinal cord. I've seen remarkable recoveries in patients. For instance, individuals with optic neuritis, a complication of multiple sclerosis, have reported restored vision after spinal decompression. Similarly, patients with chronic migraines or tinnitus have found lasting relief once the underlying tethering was addressed. Clinically, this approach has transformed lives. I vividly remember a breakthrough moment in 2015 when a patient's vision, lost due to optic neuritis, dramatically returned after spinal decompression. It was a powerful realization that tethering injuries, though invisible on standard imaging, could explain and reverse many of these debilitating symptoms.
It's incredible to think that by addressing the spine, we can influence conditions that were previously thought untreatable. Thank you, Dr. Lamb, for sharing this profound insight into the interconnected nature of neuromuscular and neurological health. Closing thoughts, a new lens for neurology. That wraps up today's episode of Neuromyofascial Science Today. We hope you've gained valuable insights into how optical coherence tomography is transforming the way we understand and approach neurological health. Dr. Lamb's pioneering work in neuromyofascial science is connecting the dots between spinal health, neurological conditions, and groundbreaking treatments. Through this podcast and our social media content, we're committed to sharing these life-changing insights and making them accessible to everyone. If you want to dive deeper, explore links to studies, research, and more on nmfscience.com. Follow us on our social media platforms for updates, key takeaways, and engaging discussions around the latest advancements in neuromyofascial science. If you found today's episode informative, please share it with friends, family, or anyone facing these challenges. And don't forget to subscribe so you never miss the next innovation or patient success story. Until next time, take care, stay curious, and let's keep spreading hope and understanding one episode at a time.